It's 1975. An 8-year-old Bangladeshi girl named Bilkis-Nessa notices a rash on her 3-year-old neighbor. Bilkis-Nessa reports the rash to her local smallpox eradication program, and the world's last known case of smallpox major is contained. Smallpox is just one of hundreds of human illnesses caused by viruses. They've shaped our history, and they impact our present lives. Yet over time, we've found ways to fight back. Today, our tools include vaccination, public education, community engagement, disease surveillance, medications, and more. We are far from defenseless against viruses. Our strongest tool is vaccination. Thanks largely to vaccination, the World Health Organization announced in 1980 that smallpox was eradicated. Vaccination has reduced the spread of many other viruses too. Polio, measles, mumps, and rubella are a few examples. Even chickenpox, once a near universal childhood experience, is much less common today. Since a vaccine came out in the 1990s, cases have dropped by 90%. Though it's a strong tool, vaccination cannot succeed on its own. It goes hand in hand with public education and community engagement. Educational efforts taught Bilkis-Nessa and others in her community to recognize smallpox, so she knew her neighbor had the characteristic rash. Public education is key to stopping other viruses too. Take hepatitis C, where an infection can go on for years with no symptoms. Meanwhile, the virus is quietly spreading in the body. Many people don't know they're at risk, so education helps them realize they need to be tested. They can then get treatment and take steps to prevent infecting others. When a new virus appears, often there's no vaccine or treatment. Here, efforts turn to public health strategies like disease surveillance. This can buy time to make a vaccine. And sometimes, these public health strategies are all that's needed. Remember SARS, a virus that jumped in and out of the spotlight in 2003? We were able to stop this new virus with no vaccine or cure in sight. Stopping SARS took a whole-of-society approach. Affected individuals and communities, local health workers, researchers, and governments all came together. They coordinated travel restrictions, testing, contact tracing, and quarantine. It wasn't simple or easy, but it worked. Within about 6 months, SARS was contained. Since then, we've applied lessons from SARS to efforts to control H1N1 swine flu, Ebola, Zika, and COVID-19. Every virus is unique, and our ways of stopping them need to be tuned to how each virus spreads. With mosquito-borne viruses like West Nile and Zika, bug nets and chemical repellent reduce spread. For some viruses, we use medicines. There's no vaccine for HIV, but we have drugs that block spread of the virus from mothers to their babies. And PrEP is a drug regimen that prevents its spread between adults. Today, our tools for controlling viruses have gotten even better. We have improved communication systems, modeling methods, genetic approaches, and medicines. These modern innovations work best in combination with time-tested lessons from the past. After all, our greatest successes come from using all our tools together. After Bilkis-Nessa reported her neighbor's illness, the child was isolated at home. Health workers used a door-to-door campaign to vaccinate everyone within a mile and a half. Education continued through nearby meeting areas, schools, and healers. The community learned the signs and stayed vigilant. All this together is what finally stopped one of the last cases of smallpox in its tracks.